Hello everyone. So today we are going to talk about how do we diagnose endometriosis. First and foremost is through your medical history. When you come to see the doctor will ask you about your symptoms. And usually it's about the pain that you have, the period pain, how severe it is, or sexual pain, how bad is the sexual pain, or pain during passing motion, and so on, and all other symptoms, including your past medical history, or past surgical history, or past obstetric history, and so on. Okay, after we have taken the history, so now the doctor will do a pelvic examination. So pelvic examination is examination, digital examination with the finger into the pelvis, looking at into the vagina. Is there any nodule in the vagina, and how big is your uterus, and so on. And after that, we will do a pelvic scan. Do you know what's a pelvic scan? So pelvic scan is there are two types of pelvic scan, which is a transvaginal scan, something like this, where we use the transvaginal probe to do the ultrasound, where we put this probe into the vagina. So, and the other one is through the abdominal scan. This is the scan probe where we put on the abdomen. So if you are single and you are virgin and no history of sexual intercourse, we will do abdominal scan. So we just run this on the abdomen. So but if you already sexually active, the best way to do pelvic scan is by transvaginal probe. What is the difference? The difference is the transvaginal probe, because we put it into the vagina, it is very close to the uterus and also the pelvis, so we can see the structure very clearly. We can see what is there any deep endometriosis. We can see the uterine shape very clearly, what is in the uterus, and we can see the ovary very clearly, and also what surround the organs surrounding the ovary, or reaction, whether the ovary is mobile or sticking to the uterus, or whether you have deep endometriosis where the uterus actually are retroverted, and or we can see the bowel, is it attached to the uterus or not. We can also see the surrounding the uterus, if there any scarring or kind of nodule that form endometriosis. Okay, how about MRI of the pelvis? MRI of the pelvis is very beneficial to diagnose endometriosis, especially if the doctor suspect that you may have a deeply infiltrating endometriosis after running through your medical history, as well as after a pelvic ultrasound. If the ultrasound are not very unclear of the location or the size of the endometriosis, and MRI is very beneficial. And MRI can detect deeply endometriosis not only behind the uterus, the parametrium, but also in the bowel, in the ureter, or into the bladder. And what about laparoscopy? Previously, we used laparoscopic examination or diagnostic laparoscopy to diagnose endometriosis, especially in young girls who has pelvic pain for a reason that cannot be explained, or pelvic pain that been too long for more than 6 months, or pelvic pain that is severe, more than 6 or over 10 the pain score, or patient with the pelvic pain which is not relieved by their usual medication. However, today laparoscopic is not the prime or the first line investigation, especially in young girls, to diagnose endometriosis. We can diagnose endometriosis without doing or undergoing laparoscopy, but by just going through the history, physical examination, and also a pelvic scan. We can diagnose endometriosis right away and start the treatment early as possible.